So once again, welcome everyone. Today's speaker is Dr. Suresh Raparthy MD, chest physician in Ajara Hospitals. Sir has been working as a consultant pulmonologist since 2013 in Hanamkonda. He's a life member of Indian Chest Society, Indian Association for Bronchology, Indian Society for Critical Care Medicine and Indian Medical Association. He is present General Secretary of Warangal Chest Society. He has participated in many national conferences like MAPCon, BronchoCon, SleepCon, etc. His expertise lies in clinical interventional pulmonology and sleep medicine, wherein all lung diseases, including asthma, COPD, ILD, pneumonia, neural disorders, obstructive sleep apnea, lung cancer, and connective tissue diseases and TB are dealt with. He's also experienced in pulmonary rehabilitation and addiction assessments. He's an expert in interventional procedures in bronchoscopy, ICPD, medical thoracoscopy, and minor surgical criticalities. He's experienced in TB, occupational and sleep disorder management, and he earlier has as a speaker and eminent speaker for many of the TV programs and as well as on All India Radio, etc. Today, I welcome Dr. Suresh Raparthy, consultant pulmonologist, to present the webinar in order to increase the awareness among the common public as well as the students alike on the sleep disorders, snoring, as well as the sleep studies. Welcome, sir. And now the presentation is on. Thank you.
Yeah, thank you, Dr. Nadeem, sir. Thank you for your introduction. So, good evening, friends. Myself, Dr. R. Suresh, working as consultant pulmonologist in Ajara Hospital. So, routinely, as everyone knows, chest physician pulmonologist means he'll be telling regarding some pneumonia problems or asthma problems or COPD problems or some related to chest. But today, many of us or even general public doesn't know much regarding the aspect of snoring, guraka. So snoring and sleep disorders. So that's why today we want to show a webinar on this regarding snoring and sleep disorders. How does it affect us? So with this, we shall start our program today. So our topic is snoring and sleep apnea. How does it affect us in our day-to-day life? So what do you think, friends? Is snoring normal or abnormal? చాలా మంది ఇంట్లో ఆల్మోస్ట్ ప్రతి ఇంట్లో ఎవరో ఒకరికి గురక అనే సమస్య ఉంటుంది. మన పేరెంట్స్కి కానివ్వండి, ఈవెన్ పిల్లలకు కానివ్వండి, లేదంటే ఎవరో ఒకరికి ప్రతి ఫ్యామిలీలో ప్రతి ఇంట్లో ఒకరికి గురక సమస్య అనేది ఉన్నది. సో మరి మీరేమనుకుంటారు? గురక అనేది ఉండడం నార్మలా లేదంటే అబ్నార్మలా? చూద్దాం నెక్స్ట్ మన ఫర్దర్ ప్రోగ్రాంలో అది ఎంతవరకు ఇంపార్టెన్స్ అనేది చూద్దాం. సో చాలా మంది అనుకుంటారు గురక అనేది కేవలం పెద్దవాళ్ళలో ఉంటుంది, చిన్న వాళ్ళు ఉండదని. నో, ఈవెన్ చిల్డ్రన్స్, చిన్న వయసు నుంచి కూడా గురక సమస్య అనేది కొంతమంది పిల్లల్లో ఉంటుంది. సో ఆ గురక సమస్య పిల్లల్లో ఉండడం వల్ల వాళ్ళకు బ్రెయిన్ డెవలప్మెంట్ కూడా చాలా వరకు తగ్గుముఖం ఉంటుంది కంపేర్ విత్ అదర్ మిగతా పిల్లలతో పోలిస్తే. అలాగే ఇలా గురక సమస్య ఎవరైతే పిల్లల్లో ఉంటుందో వాళ్ళకు చాలా వరకు డిప్రెషన్ ప్రాబ్లమ్స్ వచ్చే అవకాశం ఉంటుంది, ఎమోషనల్ ప్రాబ్లమ్స్ కానీ, ఈవెన్ పగటిపూట అతి నిద్ర ఉంటుంది వాళ్ళకు నైట్ టైం ఎక్కువ బెడ్ వెయిటింగ్, అంటే మూత్రం వెళ్ళడం బెడ్ టైంలో, తర్వాత కొన్ని రకాల డెంటల్ ప్రాబ్లమ్స్ కూడా దారితీస్తుంది ఈ గురక సమస్య పిల్లలలో ఉంటాయి. పెద్దవాళ్ళతో పోలిస్తే ఈ చిన్న పిల్లల్లో వచ్చే గురక సమస్య కారణాలు డిఫరెంట్గా ఉంటాయి. చిన్నపిల్లలు వచ్చే గురకలో కారణాలు ముఖ్యంగా వాళ్ళకు అప్పర్ రెస్పిరేటరీ ప్రాబ్లమ్స్ లైక్ టాన్సిల్స్ పెరిగినా కూడా, గొంతులో టాన్సిల్స్ పెరిగినా కూడా గురక వస్తుంది. అలాగే గొంతులో ఎడినాయిడ్స్ సైజ్ పెరిగినా కూడా వాళ్ళకు గురక అనేది సమస్య వస్తుంది. కొందరికి పిల్లలలో నేసల్ అంటే నోస్ ప్రాబ్లమ్స్ లైక్ నోస్ కంజెషన్ ఉన్నా, నోస్లో గ్రోత్ లైక్ పాలిప్ అనే గ్రోత్ ఉన్నా కూడా, లేదంటే సెప్టమ్ డీవియేషన్, వాళ్ళ నోస్లో సెప్టమ్ మిడిల్ ఆఫ్ ది నోస్లో ఉన్న సెప్టమ్ డీవియేషన్ ఉన్నా కూడా ఈ గురక సమస్యకు దారితీస్తుంది. సో ఈ పిల్లల్లో వచ్చే గురకకు ముఖ్యమైన కారణాలు ఇవి: ఎన్లార్జ్డ్ టాన్సిల్స్ పెరిగినా కూడా, ఎడినాయిడ్స్ పెరిగినా కూడా, లేదా కొన్ని రకాల నోస్ ప్రాబ్లమ్స్ వల్ల గురక వస్తుంది. అందుకే పిల్లలలో గురక ఉన్నా కూడా డెఫినెట్గా నెగ్లెక్ట్ చేయకూడదు. ఇమీడియట్గా వీలైతే వాళ్ళని పీడియాట్రిషియన్ ఆర్ సమ్ ఈఎన్టీ ఒపీనియన్ తీసుకోవాల్సి వస్తుంది. బట్ అదర్వైజ్ పెద్దవాళ్ళలో వచ్చే గురక కారణము కొంత డిఫరెంట్గా ఉంటుంది. పెద్దవాళ్ళ గురక ఈ స్లైడ్ చూసినట్టయితే నార్మల్గా మనం పడుకున్నాక నిటారుగా పడుకున్నాక మనకు బ్రీతింగ్ అనేది ముక్కు ద్వారా కొంత నోటి ద్వారా అనేది లంగ్స్ లోకి వెళ్తూ ఉంటుంది, నార్మల్ బ్రీతింగ్. కానీ ఇలా గురక పెట్టే వాళ్ళల్లో మనకు పడుకున్నాక వాళ్ళ టంగ్ కానివ్వండి, లేదంటే ప్యాలెట్ అనే సాఫ్ట్ టిష్యూ కానివ్వండి, అది ఎక్కువ రిలాక్స్ అవ్వడం వల్ల వెనక గొంతులోకి వాలిపోవడం వల్ల వాళ్ళకు అప్పర్ రెస్పిరేటరీ అంటే పై గొంతు భాగం అనేది చాలా వరకు నేరో అయిపోతుంది. మీరు ఇక్కడ ఫిగర్ చూస్తే కనుక ఇక్కడ నార్మల్గా ఉన్న వాళ్ళకు శ్వాస అనేది ఫ్రీగా వెళ్తుంది పడుకున్నాక. బట్ ఈ గురకనే ఉన్న వాళ్ళకు ఈ టంగ్ అండ్ సాఫ్ట్ ప్యాలెట్ రిలాక్స్ అయిపోయి వెనకకు గొంతు భాగంలో వాలిపోవడం వల్ల ఈ అప్పర్ రెస్పిరేటరీ ఈ ఏదైతే స్పేస్ ఉందో అది కంప్లీట్ అబ్స్ట్రక్టెడ్ అయిపోతుంది ఆర్ నేరో అయిపోతుంది. దిస్ విల్ బి నేరోడ్. అప్పర్ రెస్పిరేటరీ విల్ బి కంప్లీట్లీ కొలాప్స్డ్ ఆర్ నేరోడ్. సో ఇక్కడ ఈజీగా మీరు గమనించాలి, లెఫ్ట్ సైడ్ ఇమేజ్ లో కంప్లీట్ ఎయిర్వే ఓపెన్ ఉంది అప్పర్ రెస్పిరేటరీ పార్ట్ లో. బట్ రైట్ సైడ్ ఇమేజ్ లో మీకు ఇది ఎయిర్వే అనేది అప్పర్ రెస్పిరేటరీ దగ్గర మీకు కంప్లీట్ కొలాప్స్ అయిపోయింది. ఎందుకు కొలాప్స్ అయిందంటే టంగ్ కంప్లీట్ బ్యాక్ ఫాల్ అవుతుంది, అలాగే పైన సాఫ్ట్ ప్యాలెట్ కూడా రిలాక్స్ అయిపోయి అది కూడా మనకు గొంతు భాగాన్ని మూసేస్తుంది. సో ఈ గొంతు భాగం మూసుకుపోవడం వల్ల మనకు వెళ్లాల్సిన ఆక్సిజన్ ఎయిర్ ఎంట్రీ అనేది పూర్తిగా అవ్వదు. ఎయిర్ ఎంట్రీ అనేది ఇక్కడే ఆగిపోతుంది. సో ఇలా మూసుకుపోయిన మార్గంలోకి వెళ్ళి మనకు ఎయిర్ వెళ్ళేటప్పుడు అది వైబ్రేషన్ సౌండ్ చేస్తుంది. ఇలా వైబ్రేషన్ సౌండే మనకు బయటికి గురక రూపంలో వస్తుంది, సౌండ్ గురుగురు అని. కానీ ఇక్కడ ప్రాబ్లం జస్ట్ గురుగురు అనే సౌండ్ ఒకటే కాదు, స్నోరింగ్ అనే సౌండ్ ఒకటే కాదు, బట్ మెయిన్ ఇక్కడ మీరు గమనిస్తే అబ్స్ట్రక్షన్ ఏర్పడుతుంది. నార్మల్గా గొంతు భాగంలో ఓపెన్ ఉండాల్సిన ఎయిర్వే మనకు ఈ గురక సమస్య లేదంటే ఓఎస్ఏ, ఈ గురక ద్వారా వచ్చే ఓఎస్ఏ సమస్యలో మనకు కంప్లీట్ అప్పర్ ఎయిర్వే అంతా కొలాప్స్ అయిపోవడం వల్ల వెళ్ళాల్సిన ఎయిర్ ఎంట్రీ పూర్తిగా అవ్వట్లేదు ఇక్కడ పై భాగంలో. అది మెయిన్ గురక వలలో అయ్యే సమస్య. సో ఇలా మూసుకుపోయిన మార్గంలోకి వెళ్ళి ఇదే ఎయిర్ వెళ్ళలేదు కాబట్టి అది నేరోడ్ ఎయిర్వే నుంచి వెళ్ళేటప్పుడు అది ఒక వైబ్రేషన్ సౌండ్ క్రియేట్ చేస్తుంది. దాన్నే మనం గురక రూపంలో అంటాం. స్నోరింగ్ ద్వారా ఒక ప్రాబ్లం చెప్తున్నాం, బట్ ఆ స్నోరింగ్ ద్వారా వచ్చే సమస్య ఏంటిదని చూస్తే దాన్నే మనం ఓఎస్ఏ అంటాం, అబ్స్ట్రక్టివ్ స్లీప్ ఎప్నియా. ఈ అబ్స్ట్రక్టివ్ స్లీప్ ఎప్నియాతో వచ్చే అంటే దాన్ని మనం ఎలా గుర్తిస్తాం అంటే పేషెంట్ కి ఈ స్నోరింగ్ వాళ్ళకున్న గురక ద్వారా ఈ ఓఎస్ఏ అబ్స్ట్రక్టివ్ స్లీప్ ఎప్నియా సిమ్టమ్స్ వచ్చినట్టుగా హౌ కెన్ వి రికగ్నైజ్ అని చూస్తే కనుక వాళ్ళకి కొన్ని సిమ్టమ్స్ ఉంటాయి. అందులో మెయిన్ గా లౌడ్ స్నోరింగ్. ఈ పడుకున్నప్పుడు వాళ్ళకి లౌడ్ స్నోరింగ్ ఉంటుంది, మధ్యాహ్నం పడుకున్న నైట్ పడుకున్న లౌడ్ స్నోరింగ్ ఉంటుంది. అలాగే నైట్ పడుకున్నప్పుడు వాళ్ళకు మధ్య మధ్య వాళ్ళు బ్రీతింగ్ ఆపేస్తూ ఉంటారు, దాన్నే మనం ఏప్నియా అంటాం ఆర్ హైపాప్నియా అంటాం. సో నైట్ పడుకున్నప్పుడు వాళ్ళల్లో మధ్య మధ్యలో వాళ్ళ బ్రీతింగ్ అనేది పాజ్ చేస్తూ ఉంటారు. సో దాన్నే బ్రీతింగ్ సీజేషన్ ఆర్ ఏప్నియా ఆర్ హైపాప్నియా అంటాం. అలాగే వాళ్ళు సడన్ గా మధ్యరాత్రి సడన్ గా లేచి లైక్ సడన్ గా బ్రీతింగ్ ఆగిపోవడం, సడన్ గా మల్టిపుల్ టైమ్స్ వేక్ అవుతూ ఉంటారు. అలాగే నైట్ టైం నాక్టర్నల్ వాళ్ళ మిక్చరేషన్ ఎక్కువ ఉంటుంది, అంటే నైట్ టైం వాళ్ళు యూరిన్ బాత్రూమ్కి వెళ్ళాల్సిన ఎక్కువ అవసరం పడుతుంటుంది ఇలా ఓఎస్ఏ ప్రాబ్లం వాళ్ళకి, అబ్స్ట్రక్టివ్ స్లీప్ ఎప్నియా. సో ఇవి కొన్ని సిమ్టమ్స్ డ్యూరింగ్ స్లీప్. బట్ అదే డే టైం కూడా కొన్ని సిమ్టమ్స్ ఉంటాయి. ఇదే గురక సమస్య ఉన్న వాళ్ళకు ఒకవేళ అబ్స్ట్రక్టివ్ స్లీప్ ఎప్నియా కనుక డెవలప్ అవుతే కనుక వాళ్ళకి ఈవెన్ డే టైం సిమ్టమ్స్ కూడా మనం గుర్తించవచ్చు. సో నైట్ టైం ఇలా మనకు ఎయిర్ అనేది పాజ్ అవ్వడం వల్ల సరైన నిద్ర పోరు ఈ గురక సమస్య ఉన్న వాళ్ళు. సో అలా ఉండడం వల్ల వాళ్ళకి డే టైం ఎక్కువ స్లీపీనెస్ ఉంటుంది, దాన్నే మనం ఎక్సెసివ్ డే టైం స్లీపీనెస్ అంటాం. అలాగే మార్నింగ్ హెడ్ ఏక్, ఎర్లీ మార్నింగ్ నైట్ టైం కంప్లీట్ డీప్ స్లీప్ లోకి వెళ్ళరు కాబట్టి వాళ్ళకి ఎర్లీ మార్నింగ్ హెడ్ ఏక్స్ ఉంటుంది. అలాగే సిన్స్ మనకు వాళ్ళకు డ్రై త్రోత్ ఉంటా ఉంటుంది. అలాగే వాళ్ళకు కంపేర్ టు నార్మల్ పర్సన్స్ వాళ్ళకు మూడ్ స్వింగ్స్ ఉంటా ఉంటాయి. అలాగే డెఫినెట్ గా వాళ్ళకి లాస్ ఆఫ్ అటెన్షన్, ఎందుకంటే లాస్ ఆఫ్ అటెన్షన్ కూడా ఉంటుంటుంది. వాళ్ళకి మోర్ యాంగ్జైటీ ఇష్యూస్ కానీ మోర్ డిప్రెషన్ కానీ డెవలప్ అవుతుంటుంది. సో లాస్ ఆఫ్ అటెన్షన్ అండ్ మూడ్ స్వింగ్స్, డ్రై థ్రోట్, మార్నింగ్ హెడ్ ఏక్ అండ్ ఎక్సెసివ్ డే టైమ్ స్లీపీనెస్ అనేది డే టైమ్ సిమ్టమ్స్. అండ్ వేరే నైట్ టైమ్ సిమ్టమ్స్ చూస్తే వీళ్ళల్లో లౌడ్ స్నోరింగ్ అనేది కామన్ సిమ్టమ్ బయటికి కనబడేది. బట్ సేమ్ టైం బ్రీతింగ్ సిజేషన్, దాన్ని ఏప్నియా ఆర్ హైపాప్నియా అంటాం. అలాగే రెస్ట్లెస్నెస్, సడన్ వేకింగ్ అప్ from sleep and frequent visits to bathroom, ivi night time symptoms. So the same graph you can see here, night time symptoms, loud persistent snoring, ade guraka antam, witnessed pauses in breathing అండ్ చోకింగ్ ఆర్ గ్యాస్పింగ్ ఫర్ ఎయిర్, ఎందుకంటే వాళ్ళకు సడన్ గా గ్యాప్స్ ఉంటాయి ఎయిర్లో, అంటే ఎయిర్ తీసుకోవడంలో, దాన్ని ఏప్నియా ఆర్ హైపోప్నియా అంటారు. సో చోకింగ్ ఆర్ గ్యాస్పింగ్ ఫర్ ఎయిర్ అండ్ రెస్ట్లెస్ స్లీప్ అండ్ ఫ్రీక్వెంట్ విజిట్స్ టు బాత్రూమ్. వెరస్ డే టైమ్ సిమ్టమ్స్లో ఎర్లీ మార్నింగ్ హెడ్ ఏక్, డే టైమ్ స్లీపీనెస్, ఇక్కడ వాళ్ళు వర్క్ ప్లేస్లో ఎప్పుడు పడుకుంటూనే ఉంటారు. సో డే టైమ్ స్లీపీనెస్, పూర్ కాన్సన్ట్రేషన్, ఎందుకంటే ఇన్అడిక్వేట్ డీప్ స్లీప్ పోవడం వల్ల పూర్ కాన్సన్ట్రేషన్ and irritability and falling asleep during routine activities. So these are the daytime and nighttime symptoms of persons who have snoring and who developed obstructive sleep apnea. So how can we recognize the severity of this persons who have snoring? ఎలా గుర్తిస్తాం అంటే చెక్ లిస్ట్ ఏంటిది, అంటే పేషెంట్ స్నోరింగ్ తో వచ్చారు, సో వాళ్ళకి ఓఎస్ఏ అనే రిస్క్ డెవలప్ అయిందా లేదా ఎలా చెప్పగలుగుతాం అంటే we have
Sir, can you please explain in English?
stop bang questionnaire or stop bang response. So in this we have the patient will be asking whether you have following or not, yes or no. So we will ask snoring, is
91038763 అదే నంబర్.
snoring, yes or no, and tiredness, whether they have more of tiredness during daytime, yes or no, and is there any observed apnea during the sleep, that is we will ask for yes or no, and whether already person having high blood pressure or not, and what is the BMI of that patient, is this above 35 kg per meter square or is less than 35, and is the person more than 50 years or less than 50 years, and neck circumference of the person, is above 40 centimeters or below 40 centimeters, and gender, is he male or female. So out of these 8 questions, if the score is less than 2, then the risk is very low for developing obstructive sleep apnea. But if the score is between 3 to 4, then the risk is intermediate risk for developing OSA. But if the risk is more than 5, out of total 8, if the our score is more than 5, then definitely the risk of obstructive sleep apnea is more, or the person is at high risk for developing OSA. So this questionnaire will help simply to confirm whether patient will have OSA or not, whether to go for further sleep studies or not. We can decide at the OP basis. Again, this slide tells us which patients are at high risk for obstructive sleep apnea. So high risk category for developing obstructive sleep apnea include obesity, which is the strongest risk factor, because if you see, almost all obese patients will have snoring. So definitely obesity is a main risk factor, especially central body fat distribution. And age wise, if you see age above 50 years will have more developing snoring or OSA. But of course nowadays due to obesity, even 30 years 20 years person also will have having obesity. So but in common above 50 years will have more prone for developing snoring and OSA. And neck circumference, if person's neck circumference is more than 40 centimeters, then there are more chance of developing OSA. And nasal obstruction, if there is any obstruction in the nose due to polyps or rhinitis or deviated septum, then that person is more prone for developing OSA. And few anatomic problems in the upper respiratory part, that is nasopharynx, especially any tonsils enlargement, macroglossia, that is enlarged tongue, micrognathia, that is small jaw, retrognathia, backward jaw, and craniofacial abnormals. So these are few anatomic abnormalities in the nasopharynx which may develop for developing obstructive sleep apnea. And few neurological syndromes like muscular dystrophy and cerebral palsy also are high risk for developing OSA. And some genetic problems like Down syndrome, Peary-Robbins syndrome, and Treacher-Cullen syndrome also are more prone for developing OSA. And smokers will have more risk for getting OSA. And persons who are alcoholic or taking sedatives before bedtime are more prone for getting snoring. Of course, indirectly OSA also it's more common. And coming to endocrinology abnormalities, patients who are hypothyroid, in common, if you say hypothyroid persons will be somewhat obese with the normal persons. So hypothyroid persons are more developed for developing snoring and OSA. So these all risk factors should be keep in mind because who will develop OSA or not. We have to already spoken about snoring and snoring developing into obstructive sleep apnea. So how does this affect our health? Means if persons develops this obstructive sleep apnea disease, what are the complications he may get if he has OSA, that is obstructive sleep apnea? So persons who has OSA, he will get more chances of early hypertension, early diabetes. He may get early heart problems like stroke, heart stroke, or heart failure. He may develop early brain stroke problems, or even memory impairment will be more persons who are having OSA. And since I have already spoken, persons with this OSA, there will be excessive daytime sleepiness. So with this excessive daytime sleepiness, there will be more risk for getting road traffic accidents or even workplace accidents, because they will the sleepiness will be more in these persons during daytime. So in the same slide, you can see here persons with OSA, even the risk of death, early death is more in these patients, OSA. Even persons will have, they'll be developing even depression and anxiety problems more who have OSA problem. So these are all list of complications who develop OSA. So that's why persons who have daily snoring problem should not neglect their snoring. They should go for their investigation in deeply. So the same thing I have mentioned here, complications of sleep apnea, that is, I forgot to say regarding impotence. Even impotence develops in these patients, memory loss, stroke problems, headache, early morning headache, heart attack, arrhythmia, risk of developing diabetes, fatigue, drowsiness, hypertension, obesity. So these are all list of complications in untreated obstructive sleep apnea patients. So if you want to avoid these complications, the OSA should be addressed early stage, and he should use the treatment for OSA. So how to diagnose this obstructive sleep apnea patient? So any persons who have daily snoring problem during night time, so to confirm whether he has developed obstructive sleep apnea or not, we have the investigation of choice is sleep study or polysomnography. In this polysomnography study test, we have 3-4 varieties. We have type 1 study, type 2, type 3, and type 4. The difference only is type 1 is done by a attended polysomnography technician. The persons will be, so the technician will be throughout the night along with the patient in hospital or in lab, sleep lab. That is the difference. Whereas in type 2 study or type 3, type 4, the technician will be keeping the machine during night time, that is before sleep. The technician will apply the machine over the patient before sleep, and he goes off. That is unattended study. That is the only difference between type 1 study and type 2. Type 1, the technician will be there beside the patient throughout the sleep, so that he will observe for any other abnormalities or any other sleep disorders, and it's an audio-visual recording will be there in type 1 study. Whereas in type 2 and type 3, type 4, it is mostly of home sleep study test, and here the technician only applies the machine for the patient before sleeping, and he goes off to the same thing. Type 1 device, it is a full polysomnography or gold standard test, and it is an in-lab study, or we'll be doing this type 1 sleep study in hospital only, and we'll be recording audio-visual recording of the overnight sleep will be recording, both audio and visual. And this level 1 study, it includes almost up to 24 channels. I mean, it includes EEG recording, electrooculagram recording, electromyogram recording, ECG recording, thermistors and pressure transducers, and respiratory effort in the form of chest belt, and saturation recording in the form of oximetry, body position, and limb movement. So all these multiple channels will be there in level 1 sleep study, which is done in only hospital. Whereas in levels 2 study, it is an home-based sleep study. Here, around 7 to 8 channels will be there. The technician applies to the patient, and he goes off, and during total nighttime sleep, that will be recorded in the machine. And this type 2 or level 2 study, it includes only 8 channels. And type 3, it has only 3 to 4 channels, and it's a basic machine for sleep study test, which can be done at home itself. So the level 1 is attended study, that is in hospital, whereas level 2 is unattended, the same study, but that can be done. Level 2, level 3 can be done at home only, at the convenience of home. So the just a technician applies the machine and he goes off, and overnight it will be recorded. So here you can see the level 1 study, that is complete 24 channels applied here over the person, that is EEG, EMG, EOG, ECG, everyone, and respiratory efforts in the form of chest, belt, and if you can see to the finger applied is the pulse oximeter. So almost 24 channels are applied over the person who is undergoing sleep study. That is level 1 study, which is done only in hospital or sleep lab. So these are all different channels applied in level 1 study, and that will be recorded in the form of graph. We call it as polysomnography montage. So these are all different channels. Left side you can see. And coming to level 2, in level 2 sleep study, which can be done at either in hospital or at home, but it has only limited channels for recording. That is around 7 to 8 channels will be there. Out of that, you can see here EEG, EOG, and chin EMG, ECG or pulse rate and airflow and respiratory effort and SpO2 are recorded in level 2 study. This can be done at either in hospital or at home. And level 3, it is very basic version of sleep study test, which includes only 3 to 4 channels. You can see here, pulse oximeter is there, airflow, and even respiratory movements can be studied in this channel, along with the saturation and chest effort by the chest belt is applied. So just 3 to 4 channels will be there in level 3 study. That is a nasal flow, respiratory effort, oxygen saturation, and snoring. The snoring is combinedly recorded by nasal flow channel only. So that is regarding how to diagnose this sleep apnea problem, that is snoring leading to sleep apnea or obstructive sleep apnea. So after recording this overnight sleep study, we will get a graph or a detailed report. In that report, we will have an index, or we will have a term as known as AHI, apnea hypopnea index. With that AHI, we can categorize the patients whether they are normal or mild, suffering from mild OSA or moderate OSA or severe OSA. If the AHI index in the report, if it is less than 5, then we'll call it as normal report, or the person is normal, he doesn't have any OSA. If the apnea hypopnea index is 5 to 15, we call it as mild OSA. If it is 15 to 30, we call it as moderate OSA. And if it is more than 30, we call it as severe OSA. So based on that sleep study report, we'll confirm whether the persons have mild, moderate, or severe OSA. So coming to treatment of OSA, treatment of OSA is not just done by only pulmonologist. A group, it is a multidisciplinary approach should be there for treating OSA, because if the person is obese, he may need bariatric surgery, or he may need some dietitian help to reduce his weight. Or if the child has any tonsils or adenoids, he has to remove those adenoids or tonsils. So ENT surgeon comes into play. If the person has any retrograthia or any jaw problems, then we have to refer to dental surgeon for correction of those anatomical problems. So this OSA, of course, the core treatment will be done by pulmonologist, but even if the specific problem, we have to refer to specific specialist for correction. So what are the different lifestyle modification patient needs? So definitely first thing comes the weight loss, because 90% of the obese patients develop snoring and OSA. So lifestyle modification includes weight loss. So 10% weight gain can increase AHI, that is apnea hypopnea index, by almost 6-fold, whereas 10% weight loss can reduce AHI by almost 26%. That's why the weight loss is the core thing to implement, and should always be used as an adjunct to treatment of OSA. But if the person is already confirmed as moderate or severe OSA, first of all, we should start the specific medical treatment for OSA, then we should advise to go for weight loss. Not just weight loss itself help them to reduce their OSA. And definitely we should counsel to reduce their or completely avoid the alcohol and smoking habit, and avoid sedative use, because using sedatives will increase the chance of OSA more. And positional therapy, that is lateral position. if you observe many patients who are sleeping supine, the snoring will be more. Whereas patients who are sleeping on the one side, either left lateral or right lateral, definitely snoring will be less. So for this positional therapy, we can advise them to to wear either night shirts or straps with foam ball or tennis ball. If you want, you can see the figure. So this is one positional therapy which a patient won't lie down on the supine position due to this belt. So if the patient lies on either left lateral or right lateral, definitely the snoring will be reduced during sleep. So this can be done either readily available thing, or you can use just two to three pillows on your right side or left side, so that patient will not go into supine position. So one is lifestyle modification and the positional therapy, and persons who have oral or upper airway anatomical problems, they can advise oral devices. But this oral device should be introduced only by the help of dentist. So which cases you can advise oral devices for reducing snoring? You can see any patients who are CPAP failure. Means if you advise CPAP, but patient not willing to take the CPAP, we can advise go for oral devices. And failure of weight loss or side sleep measures in mild OSA. So in mild OSA or patients who are CPAP failures, we can advise to go for oral devices to reduce their snoring. Of course, these oral devices will not help them to 100% reduce their OSA, but somewhat better than nothing. So, but these oral devices should not be advised for severe OSA patients. So how does this oral device help them? Just it helps by increasing upper airway size by moving forward tongue or mandible, so that somewhat the upper airway space will be open during night. So there are two types of oral device, that is tongue retaining device and mandibular reposition device. So these are the different oral devices which will be advised by dentist based on person to person, which is suitable for specific persons. So, and the specific therapy for this obstructive sleep apnea patients is PAP therapy, positive airway pressure therapy. This is the specific treatment for OSA person. But not all patients require PAP therapy. Mild OSA persons no need of this PAP therapy. Only persons who has moderate OSA or severe OSA, they need only PAP therapy. Otherwise, who are normal or even mild OSA symptoms, they don't need this PAP therapy. In this PAP therapy, we have continuous positive airway pressure, we have BiPAP machines, we have EVAPs, we have ASV machines. So these are different modes in each machine. I will be telling later. So the specific treatment for OSA is using PAP therapy during night time. So this is the machine. You can see continuous CPAP machine on the patient beside on the table. It's connected to power plug. There will be a tube from machine to mask. So from the machine, the air continuously throws away. So with this continuous positive airway pressure, this you can see, if there is continuous positive airway pressure coming from the machine, it opens the collapse of upper airway, so that during sleep, the collapsed upper airway will be opened, so that during complete 6 hours when patient sleeps, the upper airway will be opened, so no chance of getting snoring and no chance of getting OSA. So this is the specific treatment for obstructive sleep apnea patients. So this is the CPAP machine and how it helps in reducing the snoring and OSA, but just it delivers the continuous positive airway pressure during the night time, continuous use. The same thing you can see here, how persons are applying during night time. Simply they will put on their mask, that is only nasal mask, no need of full face mask. It is simply the nasal mask which is applied here, and the machine, CPAP machine. If you see this slide, based on severity, mild, moderate and severe OSA. So mild OSA, primarily the oral appliance or upper airway surgery, that is either adenoidectomy or tonsillectomy, we can advise if the person has tonsils. Later only, if necessary, we'll go for PAP therapy, or even lifestyle changes like weight loss is common for all category of patients. Whereas persons who has moderate and severe OSA, definitely the treatment of choice is only usage of PAP therapy or CPAP machine. Every night time before he sleeps, he has to apply that machine during sleep till morning he gets up. So This is the specific treatment for persons who have snoring and who developed obstructive sleep apnea, moderate or severe. So what I want to advise at the end of this my topic is, any persons within your family, if they have daily snoring problem, witnessed snoring, say once in a while, once in a week or once in a month, persons getting snoring, it's okay, we can leave it. If they're diagnosed as moderate to sleep severe OSA, definitely they should go for specific treatment. Otherwise, the risk of getting complications due to OSA are more. Without knowingly, these snoring patients or OSA patients will develop early hypertension, early diabetes, early heart problems, early brain stroke problems, and their weight will be increasing without their knowing. And of course, definitely the mental mood will be changed. Either they may develop depression or anxiety. So these are all multiple complications which are associated with the obstructive sleep apnea problem. So that's why so no one should ignore their snoring habit. So with this, I want to end my topic on snoring and sleep studies. So anyone who has your snoring problem, who want to know their problem in detail, they can approach our hospital. We have level 2 studies here, in-hospital studies, and we'll be confirming the next day itself, and you can take this best treatment out of us. Thank you so much. Any questions, please?
Thank you very much, sir. It was a really insightful presentation regarding the sleep studies, which very few people are aware of. I request the participants to post their questions in the chat box, and sir will be taking them one by one. And in the chat box we have shared the link to the feedback form. Kindly give your valuable suggestions and feedback regarding today's webinar on snoring and sleep disorders. Before anyone posts it, there's one question from my side. We have talked about the adult patients regarding the sort of difficulties in breathing in the night time and all. So what are the prospects of children getting these disorders?
Yeah. What I have mentioned in the slide, children will have more of anatomical obstruction. That is mentioned. It could be tonsils, hypertrophy or adenoid hypertrophy.
Okay.
So definitely they need a surgical correction.
Okay.
Without which their snoring will not reduce.
Okay. What is the target population for the sleep studies rather? Now that you have told that anatomical reasons are for the are to be ruled out for pediatric patients, so it comes up all to the adult patients. So adult patients lo kuda, for which patients do we advise to go for sleep studies?
Yeah, that's what the high risk patients include who are obese and whose neck circumference is more than 40 centimeters, and especially patients who are already diabetic and hypertension. Also, we can advise them to go for a sleep study test. Of course, the primary includes here. The family members should complain of that person getting snoring, daily snoring. Along with that, we'll check for whether patient is having obesity or not and other findings.
Okay, sir. So you have told about the patients who are obese are at high risk of developing OSA and this problem of snoring. So any tips to actually reduce the sort of weight and healthy weight reduction in a way? It's only a healthy weight reduction to ward off the snoring and all.
Yeah. See, first of all, here two things. One is definitely we should take the help of dietitian to reduce the weight. The proper diet, which one to avoid, which one to continue, and next comes the physical activity. But the major problem here in snoring patients is unless the snoring is reduced, you cannot reduce your weight because it's a vicious circle. Patients who are overweight, they will be developing snoring, and who are daily snorers, their weight will be increasing. So unless this is broken, you cannot reduce your weight. That is the difference between normal overweight persons and persons who are snoring and overweight.
Okay, sir. Thank you. If anyone has any question, kindly post it in the chat box so that sir will be answering your queries. Ms. Swapna, you earlier told that you have a question, but you didn't post it. Or if anyone wants to talk directly and ask their question, they can unmute their mic and ask the question. I think there are no more questions. There's one question from Navina Patel. Is there any exercises available to reduce snoring in a way like physical exercises?
Yeah, definitely. Yeah, pranayama, breathing exercise, definitely it helps a lot in clearing your upper airway secretions in the sinus or in the nose. So unless your nose and sinus are clear, definitely the snoring will be more. So for this, you can take help of either yoga expertise or even physiotherapist.
Okay. Mr. Deepak Singh is asking, can it be genetic in a way like the snoring problem? Can it be genetic?
No, it can't be genetic. It's a lifestyle disorder.
Okay.
Snoring.
So, Mr. Naresh asks, where are the sleep labs available at Warangal and Hanakonda?
So, in our Ajara Hospital, we have level 2 studies right now. Maybe in future, we may go for level 1 sleep studies. So, anyone who have this snoring problem, they can approach directly to Ajara Hospital to undergo sleep study test. Yes, only thing is they have to stay for one night here, where we have dedicated room or dedicated sleep lab room. So, the next day they can go away, and by next day evening, we will get that sleep report. After seeing the sleep report, we will confirm whether they have mild, moderate, or severe OS.
Okay. Mr. Saideja asks, in a way, what he meant was, is there any neurological connection for the snoring apart from the anatomical things?
Yeah, it's not definitely because we call it as central sleep apnea. What I have termed here, it is obstructive sleep apnea, obstruction in the upper airway. We have another problem, we call it as central sleep apnea, where the connection, that is the signals from the brain to the chest wall is interrupted in those cases. In those cases, we will call it as central sleep apnea. The problem is in the brain.
Okay, sir.
So there we don't need of CPAP machine. We have to, it is neurological problem.
Okay, sir. Ms. Bhavna Ampati asks, what are the food or the diet that can be taken to avoid this snoring issues?
Yeah, see, if you're already having severe OSA by sleep study test, first of all, go for specific treatment, that is using CPAP therapy. Along with that, we should strictly follow our lifestyle modifications like reducing our weight. As you asked, specific diet means I will only advise better, since our dinner should be very light and it should be very limited and at least 3 hours before going to sleep. Dinner is very late or very near to sleep. Since after sleeping, our calorie expenditure will be very, very less during sleep. So automatically it will go into fat deposition. So anyone who want to reduce your weight or anyone who want to avoid increasing their weight gain, the main role is dinner. So if you want to have dinner, complete dinner by before 7 or 6 p.m. or at least 2 to 3 hours before you sleep.
Thank you, sir. And another question, from Harshita. Why some people get snoring immediately after sleep and after some time it goes off? Like on and off snoring.
Yeah, that's maybe one is positional. Since in supine position they will be getting more, in lateral position they will be letting less. That is positional. And of course, those patients we term it as mild OSA only, because those who have continuous snoring throughout the night, mostly they will be having moderate to severe OSA. As she asked, only some part of the night getting snoring, remaining if they are normal, mostly they will be mild OSA or normal persons. Primary snoring without any OSA.
Okay. Ms. Roshni asks, what is the risk of developing OSA with abdominal circumference, more abdominal circumference even with normal BMI? In a way, she's asking centripetal. Okay. What's the risk of developing OSA with more abdominal circumference even with normal BMI?
See, definitely, if the BMI is more than 35, the chances of OSA is more. It doesn't mean persons who are lean, for persons who are low BMI won't get snoring problem. One of my friend itself, who is very lean, he has this severe OSA. So what happens in this See, the obesity is one of the risk factor. Doesn't mean lean persons or thin persons won't get obesity. So these normal persons who are very thin or normal weight, physiological collapse will be there. The cause for their snoring is physiological collapse during sleep of upper airway. So that is the common factor in those persons. Otherwise, in general, 90% of obese patients, they will have snoring. But otherwise, even non-obese persons or normal weight gain persons also, they may get snoring and they may have OSA problem also. So irrespective of obese or non-obese, any persons who have daily snoring throughout the night, they should be subjected for sleep study.
Okay, sir. Apart from CPAP, what are the pharmacological approaches to treat the patient with OSA and snoring?
See, since there is a direct obstruction in the upper airway, so definitely we advise to go for either surgical correction by ENT help or directly go for non-surgical in the form of CPAP therapy. Since even surgical correction, if you do in these cases, post-surgery, even the snoring continues in those persons. So even after surgery also, they should go for using CPAP therapy.
Okay.
In order to avoid complications.
Okay. How much time does it take to resolve, or is it 100% curable with surgical correction and all, or are there chances of any?
One good question. This is one good question. How much time or how much duration I should use this PAP therapy? See, since unless his weight is reduced to normal condition, at least for moderate to severe cases, we'll advise for almost lifetime usage of PAP therapy. Or we may repeat after few years this sleep study. If it completely comes down to normal AHI, then we will stop them to use PAP therapy. Otherwise, moderate to severe cases, they should use lifetime continuous CPAP therapy daily at night.
Okay. So Mr. Srikanth asks, is there any sort of, what are the different types of snoring sounds? Are they related to any different sort of mechanism or obstructions, or is it something like individualized in a way, like?
No, there is nothing correlated till now.
So another question is, the people who snore don't react, or they don't know that they were snoring. So
yes,
unless someone else says that.
That's true. That's why we ask for the bed partner or family members whether this person is snoring or not daily, because no one knows. If I snore, I cannot tell I am snoring.
Okay.
Because we'll be in deep sleep. Right. So the person who are beside that person or family member or bed partner will only complain about snoring. Either he is having continuous snoring or intermittent snoring or daily snoring, only on and off occasional snoring. The only family members will tell us.
Okay. So I think this is the end of the question answer sessions. But before we conclude, sir, I want to ask one question regarding the posture we sleep. So what do you suggest? Sleeping directly supine or lateral position? Which one's the better one? In a way?
See, if it is the primary snoring without OSA or persons with have already mild OSA, definitely we'll advise them to go for lateral position sleep. Either they can use simple pillows to stay in the lateral position, or they can use some foam balls, t-shirt, which will make them automatically to lie in lateral position. Okay. So for obese, definitely they should lie in the lateral position, better to avoid the risk of OSA in the night.
Okay, sir.
That is only to reduce the snoring severity.
Okay.
It doesn't help you in reducing your OSA complications or to reducing your AHI. So if already patient having confirmed OSA in the form of moderate severe, definitely they should go for specific treatment. Along with that, this is additional, we advise them to lie in the lateral position so that the snoring severe. But once you use the CPAP therapy for specific patients, automatically the snoring comes down to 0 and your AHA comes down to 0. Slowly they will reduce their weight, and even the complications, they will avoid all the list of complications what I have mentioned. Okay. The only thing is they have to continue use that machine throughout the night every day.
Okay. Thank you very much, sir. I think by this we conclude the session. I thank Suresh sir for today's webinar and presentation. It was very insightful, sir. And
Thank you,
I
sir.
thank all the participants who joined us in this call. And this is a reminder that every second Saturday and fourth Saturday, Ajara Hospital conducts this series of webinar. This is primarily aimed at laymen and normal people and to the medical students and pharmacy students in order to understand how actually things go on in different departments. And also a sort of series of awareness campaign this is. So for the second Saturday of for the month of September, we'll be having Dr. Sampath KV, our critical care consultant. We'll come up with the topic soon, and hopefully you all are in the WhatsApp group that we have created, and we'll be sharing you the topic as well as the link for the next webinar soon. Thank you very much. Thank you very much, sir.
Thank you, sir. Thank you, everyone. Have a nice day.
I give you a feedback in the link that's given in the chat box. Everyone, that gives us a chance to look at the participants and any sort of improvements that we need to have in this program. I'm reposting it again.
And also topics, what they want in future.
Yeah, definitely. You can post what are the topics that you want. We have all super specialties and specialties with us. All the consultants are willing to share their knowledge with the students at any time, and as well as with the patients for their awareness. So kindly give your suggestions there. Thank you again.